Mike. My name's Deanna. I'm a nurse practitioner student at Youngstown State University. How are you today?
Good.
Good. So we're going to do a neurological and a musculoskeletal assessment today. Did you have any questions on that?
No.
Okay. Can you just state your first and last name for me?
Mike Moore.
And your date of birth?
4683.
Okay. And everything that we're going to do is 100% confidential. If you have any questions during the assessment, just let me know.
Okay.
Okay. So we're going to start off by assessing your sense of smell. So what I'm going to have you do is I'm going to assess your cranial nerve, the first one, which is the olfactory nerve. And I'm going to have you just close your eyes, and I need you to just take your nostril and close one nostril for me. And I need you to tell me what the smell is.
Vanilla.
Good. All right, and then that means your cranial nerve's intact. The next thing I'm going to do is just look at your cranial nerve number 2, which is the optic nerve, okay? So what I'm going to do is have you look at the Snellen chart. I'm going to stand all the way back here, and I want you, with one eye closed, go ahead and read down line 8 if you can.
DEFPDTEC.
Okay, and then I'm going to have you cover the other eye and go ahead and read line A, or read line 8.
DEFPDTEC.
Okay, and then with both eyes open.
DEFPDTEC.
Okay, good. 20/20 vision. Next we're going to do what's called a confrontation test. And what I'm going to have you do is go ahead and cover your right eye for me. Okay, so what I'm going to do is I'm going to hold up some fingers. Just tell me when you see them and how many fingers I'm holding up, okay?
2.
Okay, and
3.
okay, cover your other eye.
1.
Okay, and
2.
okay, good. All right, so cranial nerve number 2 is intact. Next, we're going to be assessing cranial nerve number 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens. So I'm going to go ahead and just start out by doing the 6 cardinal movements of gaze. So I'm just going to have you keep your head midline and follow my finger, okay? Good, no nystagmus noted. Next, I'm going to go ahead and just take a look at your pupils and see how they respond to light. So I'm going to have you just go ahead and look straight ahead for me. Okay, and your pupil was reactive to light. I'm going to do the other side. Good, so your pupils were about a 7 and they went down to a 3 whenever the light came near. Next, I'm going to have you go ahead and look in the distance. We're going to do a test for accommodation. And then I'm going to put this right here. I'm going to have you focus here and just follow as it goes in. Good. And your pupils constricted as you were looking at this and converged. Next, we're going to check the trigeminal nerve, cranial nerve number 5. So I'm going to have you just go ahead and bite down and clench your teeth. Good. And then I'm also going to have you just close your eyes for me. And what I'm going to do is just go ahead and I'm going to touch different areas on your face, and you need to tell me if it's sharp or dull.
Dull.
Okay.
Sharp.
Good.
Dull. Dull.
Good. And then I'm going to have you just open your chin for me with some resistance. You can open your eyes. Open your chin. Good. All right, appropriate, resistant, good tone, some ventricular nose twitching noted as we were doing that test. Next, we're going to look at cranial nerve number 7, which is your facial nerve. So I'm going to ask you just to do a couple different facial features for me. If you could just smile, and if you could frown, close your eyes, open them really, really wide. Good, and puff out your cheeks. Good. So symmetrical and appropriate notions noted. Next, we're going to test for cranial nerve number 8, which is the acoustic nerve. I'm just going to have you cover up your right ear for me, and I'm going to whisper in your ear. Just tell me what I'm saying.
Baseball.
Okay, and cover your other ear.
Football.
Good. All right, next we're gonna do the Weber test. So with this test, it's checking your hearing. I just want you to know if you heard in one ear, both ears, or right or left, okay?
Both.
Good. So no lateralization of sound. Next we're gonna do the Renee test, which I'm gonna just hold this up by your ear. You're gonna let me know when the sound stops, okay? Tell me when you can't hear the sound anymore.
Stops.
Okay, can you hear it?
Yes.
Tell me when it stops.
Stops.
Okay, all right, I'm gonna do the other side. Same thing. Can you hear it?
Yes.
Okay, tell me when the sound stops.
Stops.
Can you hear it?
Yes.
Okay, let me know when the sound stops again.
Stops.
Okay, good. So that's just showing that air conduction is 2 times greater than bone conduction, which is a normal finding, and cranial nerve number 8 is intact. Next, I'm going to go ahead and test cranial nerve number 9, which is the glossopharyngeal cranial nerve. So I'm going to have you go ahead and just open your mouth really wide for me. And then I want you to go ahead and say, good. And the uvula rises, so that's a normal finding. At this time too, I would also check for a gag reflex, but we're not going to do that in this exam. Basically, you would just take the tongue blade and touch the posterior wall of the pharyngeal area to elicit that gag reflex. All right, so next is cranial nerve number 10, which is the vagus nerve. So what I'm going to have you do is just go ahead and swallow for me. Okay, good. And then just say your name.
Mike.
Okay, and I don't note any hoarseness in your sound, so cranial nerve number 10 is intact. Next is cranial nerve number 11, which is the spinal accessory nerve. So what I'm going to have you do is just turn your head with some resistance. Good. Same thing on this side. Good. And then shrug your shoulders. Great. All right, so good muscle tone noted, appropriate strength. Next, we're going to check the cranial nerve number 12, which is the hypoglossal nerve. So I'm just going to have you go ahead, stick out your tongue for me. Good. And tongue is pink, moist, midline. I'm going to have you turn it to the left and right. And then go ahead and with your cheek, go ahead and put resistance there. Good. I'm going to put some resistance to push against my hand. Good. So good muscle tone of the tongue, appropriate midline. All right. All right, so that kind of concludes the assessment for the cranial nerves. Now we're going to check for the cerebella and proprioception. So I'm going to have you start by doing the rapid rhythmic motions of movement. So what I'm going to have you do is take your palms down, slap here, and then move them up. Go up and down. Okay. Okay, good. And just go a little bit faster. All right, good. Appropriate and symmetrical movements. Next, we're going to do what's called the nose test. So I'm going to have you touch your nose and go like this. Good. And go faster. Keep going. A little faster. All right, good. Accuracy of movements. Now you're going to touch your nose and then touch my finger. Okay. Do it again. And do it again. Okay, good. All right, next test is the heel to shin test. So I'm going to have you take your heel and come up to your shin. Good, and do it with the other side. Perfect. And then that was rapid, smooth, and accurate movements. Next, you're going to go ahead and stand for me, and then I'm going to have you walk that way. Good, and then go ahead and walk back towards this way, and then stop there, and do heel to toe, like this. Okay, good. All right, so good balance noted with that. All right, next we're going to do the Bromberg test. So what I'm going to have you do is I'm going to have you cross your arms, and I'm going to have you close your eyes for me, and just stand straight for me. And typically with this test, you should wait about like a minute and see if there's any evidence of any swaying. But just for the purpose of the video, I'm going to go ahead and stop now. Okay, no swaying noted, so negative Bromberg test. And then we did observe your gait. I observed your gait as you're walking back and forth. You had good posture. Your symmetrical movements were, your swaying of the arms was with the gait, and there was no abnormalities with your gait and posture. All right, so I'll have you go ahead and sit down. Are you okay sitting down? Okay, so I'm gonna test those sensory responses to superficial touch and pain. So what I'm gonna do is I am going to have you close your eyes, and in various locations, I'm just gonna kind of like touch either with something dull or something sharp. So I just need you to tell me if it's dull or sharp.
Dull.
Okay,
Dull.
okay,
Dull. Sharp. Sharp.
okay.
Dull.
All right, next I'm gonna have you, I'm gonna do a perception of position and sense of movement. So what I'm gonna do is have you hold out your fingers, and I'm gonna have you close your eyes again. And then I just want you to tell me if I'm moving your fingers up or down.
Up.
Okay.
Down. Up. Down.
Okay, I'm gonna do the same thing with your feet here. Okay, so just tell me if I'm moving up or down.
Up. Down. Up. Down.
Okay, good. All right, next I'm gonna be able to see if you're able to identify a normal object by closing your eyes, and then I'm just gonna have you touching and feeling to see what it is. Okay, so go ahead and just tell me what that is.
Keys.
Good. And then next we're gonna do something called 2-point discrimination. So I'm gonna be touching in various locations. I want you to tell me if you feel it at 1 point or 2.
2.
Okay.
2. 2. 1.
Okay.
1. 1.
Okay, good. All right. Okay, then I'm gonna just have you hold out your hand for me. Close your eyes. I am going to draw a letter in your hand, and I just want you to tell me what letter I'm drawing.
D.
Good. Okay, and then next we will be able to see if you can identify what body area I am palpating and touching. I'm gonna have you close your eyes, and I'm just gonna touch you. Tell me if it's the right, left, arm, leg, hand, okay? Go ahead.
Left cheek.
Okay,
Forehead.
okay,
Right leg.
okay,
Left leg.
okay,
Right arm.
okay, good. All right, so now I'm gonna have you go ahead and lay in the bed, and I'm gonna ask you just to lift up your shirt so I could test for some different reflexes. So the first reflex I'm gonna check for is the abdominal reflex. So I'm just gonna take the sharper edge, and I'm just gonna be palpating up, and I'm looking for abdominal muscle contraction, which I see, and then I'm just gonna move down, and the umbilicus here, and I see good muscle contraction noted. So that's a normal finding. Next, I'm just going to check the Babinski. So I'll have you go ahead actually and just turn to a sitting position, and then I'll have you dangle your legs here. And I'm just gonna hold up your leg here, and I'm just going to just relax your foot for me. Okay. And negative Babinski, which is a normal finding. Positive Babinski is only noted in children less than 2 of age. All right, so now I'll check all the different reflexes on your body. So I'm gonna go ahead and start with checking your triceps here. So I'm just gonna have you relax your arm and just let it really, really relax, okay? Okay, and then let me check the tricep on this side. Okay, and then let me check, just relax your arm here. I'm just gonna check the brachial. Okay, good. Okay, and then I'm going to do the brachial radialis. Okay, and I would say for the upper trunk, it was probably like a +1. The reflexes were diminished. Now I'm going to go ahead and check down your lower extremity reflexes. So I am just going to go ahead and check the patella reflex. Okay. Okay, and +1 for that. Next, I am just going to do the Achilles. Okay. Okay, Good. So +1 on your lower extremities as well. Lastly, for the neuro exam, I just want to check some ankle clonus. I'm not going to do his right foot just because his leg really bothers him from his back. So I'm going to just do the left leg for this portion. So I'm just going to flex up, down, okay, and no clonus noted. All right, now moving on to the musculoskeletal portion. I am basically just going to have you go ahead and stand up, Mike. And I'm just going to inspect from like the anterior angle, and I'm going to look over here at the lateral and posterior. I'm just going to lift up your shirt here. Okay, good. Okay, skin is warm to touch. Okay. And I don't see any deformities. Appropriate size for all the skeletal features. Alignment's appropriate. Next, I'm going to go ahead and just move on to any tenderness, by the way, when I was touching your skin. Okay. All right, next I'm going to go on to inspecting the skin and the subcutaneous tissues and joints all over. So I'm just kind of palpating here at the joints. Can I see your hands, please? Okay. All right, and color is appropriate for ethnicity. No tenderness when I was touching. Okay. No deformities, no masses, no swelling, and no nodules felt. And then I'm just gonna kind of, when I was doing that, I was also looking at the muscles, and I did not see any muscle spasms, no fasciculations. They were appropriate size and symmetrical. All right, so now I'm gonna go ahead and get started with the hands and the wrists. So I'm just gonna have you, if you can hold out your hands. So I'm just gonna look here and this way. So no appropriate skin color, warmth to touch, no deformities noted. I'm gonna go ahead and just palpate the joints in your fingers here. And I don't feel so far no swelling, no nodules, any tenderness. Okay, no. Good. All right, so no tenderness, no warm. It was just warm to touch, no redness. Everything looked appropriate, no deformities. Next, I'm just gonna check some of the range of motion now. Okay, so what I'm gonna have you do is I'm gonna have you go ahead and hold your hands like this, and fingers separated, and bring them back. Fingers down, fingers up. Okay, and then I'm gonna have you take wrists up, wrists down. Okay, and then I'm gonna do some passive range of motion. Just keep your hands in fist. Okay, good. So full range of motion noted there. And I'm gonna have you do a thumb to finger. Okay, great. And then go ahead and hold your wrist like this and go in and out. Okay, perfect. So full range of motion noted. Now I am going to test some strength. So what I'm going to have you do is just squeeze my fingers as hard as you can. Great. So strength is grade 5, which is normal. Next, I'm going to go ahead and just inspect the elbow here. So I'm going to actually have you flex first to take a peek here. And I'm looking at the Licorion process. Everything looks intact, appropriate color, symmetric. I'm gonna go ahead and look to the other side here. The Licorion process looks good. No swelling noted. It's symmetrical with the other side, properly aligned, no deformities. All right, and then I'm just gonna have you relax it. Okay, I'm just kind of palpating any pain here.
No.
Okay, and any pain on this side?
No.
Okay, so no pain. Warm to touch, no tenderness. That looks appropriate. So next we're just going to work on some range of motion exercises just to test to see how everything is. So I'm going to have you go ahead and bring your elbows in, elbows out, and then I'm going to have you go ahead and bring your palms up and palms down. Okay, then I'm going to have you bring your arms up again and then push against mine, okay, and push back. Good. Strength is appropriate, and then I'm gonna just go ahead and just check some passive range of motion. Good. Good. All right, next with the shoulders, I'm just kind of inspecting your shoulders here, and I'm kind of palpating as well. Scapula feels good. Everything seems symmetrical, even. Any tenderness as I was palpating?
No.
Okay, good. So next what I'm going to do is just go ahead and do some active range of motion with the shoulder. So the first thing I'm going to have you do is go ahead and raise your arms above your head. Okay, bring them back down. Then I'm going to have you go ahead and bring your arms like behind your back. Good. And then let's go ahead and like scratch your back and the other side. Good. And then reach behind you and try to scratch your back. Same with that. Any pain or anything when you were doing that? Good. Good. And then I'm going to have you just go ahead and move your arms away from your body and then bring them back in. Good. And then I'm just going to help do some passive range of motion. Good. And bring this up. Good. All right. So range of motion is full, no pain with assessment. As for the muscle strength, I'm going to have you, I already did this with the neurological exam, but we'll just do it again. Go ahead and shrug your shoulders. Good. So good resistance. So grade 5. Next, I'm going to go ahead and just assess your temporomandibular joint. Any pain or tenderness here? Okay, symmetrical, no swelling noted, no deformities, warm to touch. So I'm just going to have you go ahead and open up your mouth for me and close it. Okay, any pain with that?
No.
Okay, no pain, no popping, no crepitus noted with that assessment. The next thing I'm going to have you do is just go ahead and open and close your mouth for me. Good. And then kind of move your mouth to the side, each side. Good. And then just to check for some resistance, I'm going to have you go ahead and just clench your teeth together. Good. And the muscles, I felt some resistance with that, so that's appropriate for that. So grade 5 for muscle strength and full range of motion and no TMJ noted. Next, I'm going to have you just stand up so I can kind of look at your cervical spine here. And I'm just going to have you turn towards the camera. Okay, so your cervical spine right here is concave. It is symmetrical. No deformities noted. And then I'm just kind of palpating over here as well at the sternocleidomastoid muscle. And I'm coming back here to the trapezius muscle. And I don't feel any redness. Do you have any tenderness back there?
No.
Okay, you can go ahead and have a seat. No deformities noted. Everything looks properly aligned. Your head looks properly aligned with your shoulders. And then color is appropriate as well. And I didn't note like any spasms or any twitching when I was assessing your muscles either. So next we'll do some range of motion exercises. So I'm going to have you go ahead and just move your head forward, move it backwards for me. Okay, and then I'm going to have you go ahead and turn your head to the left and the right. Okay, good. And then go ahead and go ear to ear. Okay, good. And then just to check muscle strength, I'm going to have you go ahead and push against me. Good. And push behind me. Great. And then just relax your head. I'm just going to check some passive range of motion. Good. So full range of motion, grade 5 for muscle strength. Everything looks really appropriate there. Next, I'm going to go ahead and just check the thoracic lumbar area. So if you could just stand up again for me. Is it okay if I lift up the back of your shirt?
Yeah.
Okay. So I am just going to look here and check here. C7 is typically a prominent landmark. And I'm just palpating down, closed vertebral column, no swelling, deformities, everything looks properly aligned. Can you just do me a favor and bend over for me? Any further? Okay. And Mike does have a bad back, so this is about as far as he can go. If he go a little bit further, I'm just kind of checking to make sure there is no S curvature that would indicate any scoliosis. All right. So color was appropriate, no tenderness, no swelling, besides just some pain if he goes much further than that. So what I'm going to have you do now is I'm just going to palpate back here. These are the paravertebral muscles. Any pain or tenderness?
No.
Okay, and I didn't feel any muscle spasming as I was assessing them, and they felt appropriate, symmetrical in nature. All right, so for as range of motion, go ahead and just turn to the front here. What I'm gonna have you do is I'm going to have you try to bend forward as much as you can to touch your toes. Okay, so some limited motion with that, and then can you just hyperextend your back? Good, so full range of motion for that, and then I'm gonna have you just bend at each side. Good, and to the other side. Okay, so mainly just limited range of motion with the flexion. The rest was full. As for muscle strength, what I'm gonna have you do is just like cross your arms for me and kind of like push towards me this way. Good, and that way. Good. So muscle strength is a 5+. Since we did have some issues trying to bend forward, I am going to do an additional test called the straight leg test. So what I'm going to have you do is come and lay flat on your back for me, and this test just involves you keeping both legs straight, and if you could try to lift up the right leg for me. And is that painful?
Yeah.
Yeah, okay. So that is a positive, right? For a positive straight leg test that indicates either sciatica or a potential herniated disc. And then let's go ahead and do the same with the other one. Do you have any pain with this leg?
No.
Okay, great. All right, so that could indicate like a herniated disc at L4, L5, or S1. Mike already has a scheduled MRI and an appointment with the neurosurgeon scheduled to take care and follow up with these concerns. The other test I am going to do is called a femoral stretch test. So this means this time you are just going to lay on your belly. So go ahead and flip over and lay on your belly for me. And then I'm just gonna have you lift up your leg for me. Like bring it all the way up. Is there pain?
No.
Okay, what about this one?
No.
Okay, go ahead and roll back over. So the femoral stretch test was actually negative. A positive sign would indicate maybe some nerve damage, so that's a positive. That was a negative test, but a good sign for you that there's no nerve damage. Next, I am going to have you go ahead, Mike, and we are going to come to a standing position so I can just kind of inspect your hips. So I'm just looking at the alignment. They look properly aligned with the rest of your body. Let me just come to the side here and look. And I am going to just palpate the iliac crest, which are symmetrical. Any pain or tenderness?
No.
Okay. All right. So normal size, no deformity, appropriate in color, no redness, no swelling. The iliac crest is symmetrical. All right, so doing some range of motion exercises, I will have you get back in bed and just lay flat on your back again. And I'm actually gonna have you bring your knee up to your leg and go ahead and bring it down. And bring this knee up and bring it down for me. I'm going to have you go back on your belly again. And lift up your leg. You might need to come back for the camera purposes. All right, go ahead and lift up your leg, good, and your other leg, great. All right, so then go ahead and roll back on your back, and I am just gonna check, I'm gonna go ahead and do some abduction, moving it away, and bringing it back, adduction. Any pain?
A little bit.
A little bit, okay. And then go ahead and do some abduction, and any pain with that?
No.
Okay, so just some pain on the right side when we were doing that. Next, I'm going to do some internal rotation. So I'm going to just bring your leg up, and I am going to bring it this way. Good. Any pain with that?
A little bit.
Okay. And then I'm going to do the same with your leg here. And any pain?
No.
Okay. And then we're also going to just check for the external rotation. So I'm going to go ahead and bring your leg up this way. Any discomfort with that?
No.
No? Okay. And go ahead and bring it up with this and relax.
No.
Okay, perfect. So really your range of motion was a full range of motion, but there was some pain with the internal and external rotation of the leg and the abduction. Now what I'm going to have you do is go ahead and bring your knee up again for me, and I'm just going to put some resistance and just push against it, okay? And go ahead and bring that leg down and pull this one up and try to push against me. Good. All right, so strength is 5+, which is normal. All right, so one other test, a couple other additional tests I'm gonna do is one is called a Thomas test. And this is just while you are laying there, you're going to keep your legs straight, but then you're gonna flex your this leg to your knee, and then just bring that all the way to your chest for me, and hold it there. Good. And bring that down, and then bring your other leg to your knee. Good. So as I was doing that test, it's a negative test, which is a good thing. He was able to keep his extended leg on the bed, so there was no concern for any issues with his hip. All right, so next we're gonna do what's called a Trendelenburg test, where you are going to go ahead and stand up for me, and I'm gonna have your back face this way. And what I'm gonna do is just look at your iliac crest here, and then I'm gonna have you go ahead and balance on this foot. Okay, and with the other one. Okay, good. All right, go ahead and sit back down. So negative test there. We were just looking to see if the iliac crest drops whenever you were balancing on your foot. All right, so that was a negative test. Next, I'm gonna just go ahead and we're getting to the end. I'm gonna do your legs and your knees. So I'm just gonna kind of inspect here. So I'm gonna go ahead and roll your pants up for a second. And your knees look appropriate color. I don't see any swelling, no deformities. They look properly aligned, they're midline. Let me just look back here. No swelling in the popliteal area. No swelling back here. And then I'm just gonna kind of palpate. Any pain or tenderness?
No.
Okay. Any pain or tenderness here?
No.
Okay. All right. So next I'm just gonna go ahead and I didn't feel like any crepitus or any nodules when I was also palpating the knees. And then let me just look here at your shins too. Okay, good. Proper alignment with those. All right, so now what I'm gonna have you do is while you're sitting, I'm gonna have you just kind of flex your leg back. Good. Flex at the knee. Good. And then go ahead and just bring your leg up and do the same. Good. And then I am gonna help with some abduction. I'm just gonna bring the knee away from the body and doing some adduction, bringing the knee in. Any pain with that? Okay, and I'm gonna do some more abduction away and adduction in. Any pain? Okay, good. All right, and then as for muscle strength, I am gonna have you go ahead and flex your legs up and bring them like this way. Good, and back. Good. So muscle strength is a 5+ full range of motion with the legs and the knees. Next, I am just gonna have you stand up for me. I'm gonna have you leave your pants like that, if that's okay. Turn around. I'm just gonna look at the back of your legs here. Okay, good. Your feet look appropriate. As you're weight bearing, I don't see the weight bearing seems midline. Go ahead and sit back down for me. And I'm just gonna check back here. And with non-weight bearing, everything looks midline as well. So feet have no deformities. I'm just palpating the medial malleolus and the lateral mediolus and the Achilles tendon. Any pain or tenderness where I'm touching. Okay. All right. And then 1, 2, 3, 4, 5. Okay, good. And then there's 5 toes on each of the feet. And I'm just going to palpate the joints here. I don't feel any nodules. Okay, any pain with that?
No.
Okay, good. So appropriate color, skin is warm to touch, no deformities, everything looks symmetrical. 5 toes on each side, smooth contour, and the feet are aligned with the tibia. All right, and then we're just gonna do a little bit of range of motion with that. So what I'm gonna have you do is I'm gonna have you flex your feet up and then down. Good. And then back up. Good. And I was also checking for muscle strength with that as well. And then what I'm going to do is I'm just going to push one ankle in. And I'm going to check out for abduction and in for adduction. And same with this. Good. So full range of motion, 5+ for strength. And one thing I don't know if I mentioned earlier when I was assessing the hands, there is 5 fingers on each hand. All right, Mike, one last thing too, I already did assess the gait and posture. So when I did assess that, just to not have to make him stand up and repeat that, but everything was appropriate. The head was over the gluteal cleft, the shoulders, iliac, and gluteal areas were all aligned. Same with the occiput, shoulders, and buttocks, and the heels were all aligned vertically. So everything was nice and symmetrical. Your balance was good. Gait was smooth. And I think that pretty much concludes this assessment. Did you have any questions?
No.
All right. Well, thank you, Mike, for your time. If you have any concerns, please reach out to the office.
Thank you.
Okay.